Mortality rates are going up in the United States, and we need to figure out what to do about it. So we've built an app to help understand mortality and the factors behind it at the national, county, and state levels. The app works by examining data for the Centers of Disease Control. Here we're looking at deaths of despair. These are deaths due to suicide, overdose, substance abuse, and poisoning, basically self-harm. And here we're going to look at the rates in the United States by county, and we can look through time. Here it's light, there's not too much of the deaths of despair, and as we move through time, we can see it gets worse and worse and worse and worse until we get to 2015, 2017. And here we can see that there are large areas of the United States that are experiencing high rates of mortality. If we look over here, we can see a curve that shows the mortality rate in the nation through time, and we can see that it has risen over 90% in less than 20 years. MortalityMinder is an interactive presentation, so we can dig down into details of why this is happening by moving to the next page. So here we can see we can divide the counties into different risk groups. So we have 6 different risk groups, and these represent the curves for those risk groups. So we can see that some counties are doing extremely well, while other counties have increased risk, where these dramatically bad ones here having the highest rates. And then we can look at, based on those, we can look at socioeconomic factors, which are associated with these dramatic increases in mortality. So here we can see the top factors for deaths of despair in the United States are being mentally unhealthy, having frequent mental distress, being physically unhealthy, and being unemployed. To further understand, we can examine what's happening at the state level. You can select states that you're interested. I'm going to go to the state of Ohio. And here we can see in Ohio that we have high-risk areas in the Ohio Valley and better risk up here. And you can see here that the best areas in Ohio are actually much better than the state and the national average, which is shown in blue. But we have these counties that have had almost a 3-fold increase of deaths of despair. So we can again look at the factors determining them, and here we can see that single-parent households is a top contributing factor, while home ownership is protective. MortalityMinder enables individualized view from a state's perspective. So let's look at another state, California. If we look at California, we can see that there's different risk groups, and if we look at a county here like Los Angeles, we can see that it's in this low risk group, and that's actually Los Angeles' mortality rate. It's very, very good and flat. And we can look at a high risk group like Humboldt County up here, and we can see that it's much, much higher. And this is the national average. Much of California is doing better, but some places are doing very poorly. And if we ask why, we can look at the associated social and economic factors. And we see that having food insecurity, being rural, being a non-Hispanic white, being mentally unhealthy, all contribute to deaths of despair, and having good access to food helps. If we want to drill down into more detail, we can either swipe to the next page or hit the caret, or we can pick one of these factors. And then we get the definition of the factor and its source. This is from Mind the Meal Gap, and we got this originally from County Health Rankings. We can see the correlation and significance. And we can also look at individual counties. If we look here, we can see individual counties plotted, and you can see they're colored by the risk group. This is the mortality rate. This is the food insecurity. And you can see this is a clear upward trend. This is also represented in box plots that show the distribution for low, medium, and high risk counties.
This entire analysis can be repeated for other causes of death.
If we move to the next page, we get a full description of what's going on here, including the ability to download the source data and download the current results. This app is an open source app written in R. It's available on GitHub, and there is a wiki that fully documents all features of the app.
MortalityMinder was created by students in the Health Analytics Challenge Lab at Rensselaer Polytechnic Institute with generous support from the United Health Foundation and the Rensselaer IDEA. Our hope is that this app will enable healthcare organizations and policymakers to understand the determinants of mortality to improve longevity in the United States.